Welcome. I'm Michael Pierce, and this is The Human Condition. Today our topic is the secrets of chiropractic techniques. Chiropractic techniques have been asked about by my patients and my non-patients. I'm in the weird position in my life now with YouTube where I have more people asking me questions that are not my patients around the world than those who are my patients, which is new to me. But my patients have asked me about these different chiropractic techniques because I refer, as a chiropractic neurologist, I refer in direct care to a lot of different chiropractors that do different things. And some of them are expert in different techniques in ways that are far more expert than I am in their particular sub-methods. So I want to describe those methods today for you because they're really cool and they're really exciting, and I think you should know about them because there's a lot of methods in chiropractic that can help people and you may not know about them. So the first thing we do is divide chiropractic into the what are called high velocity, low amplitude, HVLA techniques, which involve a thrust. Now, if you've ever seen a chiropractic adjustment on YouTube, you know that there's a thrust. It's usually fast, and it's usually light, and it's usually short in distance, and there's quite a little twitch to it. The doctor gives a very measured, skilled, trained thrust to the patient's joint, and you hear a crack sometimes. And that's the typical chiropractic that most people understand. And there's many techniques that are in that category. And there's also a category called low force techniques, which are even lesser force than that, which involve sometimes holding a soft tissue point or a ligament or a tendon, and others involve a very, very light force with a machine, or they involve a person lying on blocks and using gravity to shift their pelvis into the right position, or they use very light force pressing on the sutures of the skull to move the sutures of the skull and change how the cranial respiratory rhythm works for craniosacral work. And so those are low force techniques, and there's many of those too. So I'm going to describe a bunch of them, but not all of them. There's over 200 chiropractic techniques, just like there are many, many named surgical techniques. Surgeons have textbooks of surgical techniques that are named after proper names of people about this different kind of approach or that different kind of approach. And we have the same thing in chiropractic. And I'll mention also that while chiropractic doesn't have all of the research that drugs have, a lot of the drug research is captured agency and captured scientists, and it's not always true. So please don't look at this profession as though it's not scientific. We're growing more and more, and in the last 10 years we've had more science than ever. We've got a growing version of DCs that are also PhDs that are doing great research. And so I'd like to dispel the myth that chiropractic is only for bones and back pain. There's a group of people that want to just focus on chiropractic for back pain because that's where it's logical to think, and there's a lot of evidence that we're just moving bones and we're just moving joints and we're correcting back pain or spine pain. But chiropractic was born by an adjustment of a guy who lost his hearing, and his hearing came back from an adjustment. So I think it's really important to remember that chiropractic also has had hospitals in the United States and in other countries that were aimed at mental health. And so the adjustment was given in order to help with addiction or criminality or immune problems or infections or other illnesses that were way beyond mechanical low back pain. So I really don't want to throw that idea out that chiropractic should be confined to just mechanical back pain or things like, we call ourselves disc jockeys sometimes because we work on spinal discs. And so I just want to go beyond that because most of my career has been outside of pain. Most of my career has been beyond pain, understanding and using chiropractic science to help people with conditions that are beyond pain. Those mechanisms are complex in some cases, and we'll explain those in another video. There is another difference among chiropractic techniques. Chiropractic techniques tend to be related to either upper cervical, which is the upper neck, or pelvic, which is the pelvis. So there are techniques like the Logan basic technique, which is focused around the sacrum, which is that triangular bone at the bottom of your pelvis between your hip bones, and that sacral bone is a triangle, and it can be manipulated and moved and changed in its position and its movement with low force techniques called the Logan basic technique. That's just one of many low force pelvic based techniques. The other very famous one is called Sacro-Occipital Technique. And Sacro-Occipital Technique was invented by a marvelous chiropractor who was also a chiropractic radiologist, and that means he was an expert in X-ray. This expert was able to use blocks. They were pelvic blocks that were made of wood. Today some people use foam, but they're mostly wood and foam. and they're wrapped in a leather or naugahyde or some kind of fake leather that allows them to be placed oppositely like this or like this over the pelvis, or like this to make the pelvis tilt in different ways and torque in different ways to align a misaligned pelvis and lumbar spine using gravity. The doctors may add manipulations on top of those blocks that are extremely gentle to the muscles or to the ligaments or to the bones, and they may do other osseous, or we call them osseous, which means the high velocity, low amplitude adjustments that give you that little pop or that click sound when you adjust someone. The upper cervical techniques are ones that my school is famous for. Palmer College of Chiropractic was founded by the Palmer family, and they were of the belief that chiropractic really started at the top of the spine. Now, today, if you're a scientist chiropractor, you don't really pick one religiously and say, oh, it's this or it's this always. You look at the patient and you use critical thinking and logical medical reasoning to figure out which patients would respond best to a pelvic-based care that goes up the spine and reaches the atlas, or an atlas-based chiropractic approach that would start with the upper cervical spine and progress down to the pelvis. And everybody uses critical thinking if they're smart. We don't want to have dogma. We don't want to have a technique-based religion where you just, apply the same technique to every person, because that's not really science. That's just kind of, religion. The upper cervical techniques are several. There's a National Upper Cervical Chiropractic Association technique called NUCCA, and that's a technique that uses a very specific X-ray analysis of the upright patient to analyze how their head and neck are misaligned, and there's some very complex classifications, several different categories of misalignment of whether the head is tilted this way or this way, whether the atlas slides this way or this way under the skull, and how it rotates. And you come up with a three-dimensional vector or an aim of how a person should be adjusted. And the NUCCA technique uses a doctor in a very interesting position where they bend over and they adjust the patient with their hands, and they use very, very tiny little adjustments. And I became certified in this method long ago at Palmer. I don't practice it, but I definitely refer for it, because in people that have certain misalignments of their neck, they do very well with this. Other people can receive relatively crude and gross adjustments that are just nonspecific, and they do fine, and that's okay. In fact, the profession of osteopathy is a great profession where osteopaths do long lever adjustments instead of short lever adjustments, and they manipulate a region of the spine without trying to be specific. And that works very well for a lot of people. So I don't want to speak ill of that. I want to speak well of it, because I've received those manipulations and they feel great, and they can work great for people. But some small group of people, and that usually ends up in my practice because I end up with the difficult cases by referral, some of them, some small percentage, need those specific vectors and a specific aim. Now, the NUCCA method also has sister technique called atlas orthogonal, which uses almost the same X-ray analysis, except instead of the doctor using their hands and their body to aim and use their mass and a very small pull to adjust the person without a thrust, the atlas orthogonal uses a table with a stylus that rotates around. The stylus is an aluminum piece of metal that is aimed in 3D, somewhat like this pen. The patient's laying on their side on a special fulcrum, and the stylus is put on their neck onto the atlas, and it's designed to correct the entire complex of the skull, atlas, and neck all at once by taking advantage of engineering and physics and formulas to try to figure out how does the head correct, the atlas correct under the head, and how does the spine under that correct all at once, so that one adjustment lines it all right up. And you'll find that that's a very powerful adjustment. It's the same vectors, mostly the same vectors and aim in 3 dimensions as the NUCCA, and the same X-rays and the same analysis. Doctors will draw lines and make measurements and make calculations to make their final vector of how they will aim either their NUCCA adjustment or their atlas orthogonal adjustment. In fact, founder of Atlas Orthogonal, Roy Sweat, has just passed away recently, Roy Sweat Sr., and he was a mentor of mine, and we mourn his passing, and we're glad for him to have walked this earth. He's helped a ton of people with incredibly low force adjustments. The Blair technique is another adjustment that is a chiropractic technique for the upper cervical spine. It's a technique that looks at the condyles. The atlas is a vertebra that is a very small ring, and it has condyles that hold up the skull. And so it's called atlas because it's much like the figure from Greek mythology who is Atlas, who holds up the world. And his 2 hands are the condyles that hold up the world. Actually, they hold up the condyles of the skull that holds up the world. They are not condyles. So the atlas bone has those fossa that hold up those condyles of the skull. And the Blair technique tries to align the way that those atlas articulations articulate with the skull and how they slide side to side. And they also use an X-ray technique that's highly accurate and very specific. My own school has palmar upper cervical, which was also called toggle recoil. This is a method that's used where a patient lies on their side and receives a fairly gentle but fast adjustment that is an adjustment with a thrust and a recoil, where the doctor has their hands recoil, and the patient receives a very light, fast adjustment that moves their atlas, very similar to NUCA and atlas orthogonal, except a little bit more force and a little bit more excursion and thrust. So that's a palmar upper cervical or toggle recoil. This evolved into a biomechanical method of looking at the whole spine, not just the atlas, and that's methods that are like, and I'm going to lump them together, Pettibon method, named after Burl Pettibon, chiropractic biophysics, Pierce Stillwagon method, Pierce Pettibon method. There's a whole series of different methods that were created by engineering types that were looking at engineering and mathematics and x-rays, and they're trying to figure out with different ligaments, how should we correct the spine using different preloaded technologies. So in those particular techniques, what they'll do is they'll preload the spine to end range and then deliver a thrust or an adjustment with a machine or by hand or a drop table of some kind. And that brings us to one of the most famous chiropractic methods called the Thompson method. This was named after J. Clay Thompson. Dr. Thompson was a chiropractor who invented the drop table, and the drop table just drops about 1/4 of an inch. It's just essentially a plate under your pelvis or under whatever area you're going to adjust under your neck. And it's a board of plywood with some high density foam and some naga hide leather or some material that's comfortable over top of it. Patient lays on the chiropractic table, much like a physical therapy exam table. The doctor will pull a lever that makes the plate come up based on a hinge back here, and the plate comes up only about 1/4 of an inch to 1/2 of an inch. And then you have a dial that is a spring-loaded ball bearing joint that allows for that piece to drop with a certain weight. So what you're actually doing is you're weighing the patient and finding the resistance of how much weight you need to support the patient when the table is cocked and the piece is up. And then when the doctor puts a thrust on the person, the patient falls through space by this distance, and then the bone that they're contacting goes past the bone that's next to it. And so what you do is you get a nice adjustment by having the person's body stop, and then the body part you're contacting goes just a little bit further. So it's a low force way of adjusting people. It's often done face down, but it can be done face up. And other techniques have taken the drop method, like Pettibon has used the drop method for the atlas. And so there's some really, really neat technologies. One of my mentors, Dr. Fred Barge, who has long left us, he died long ago, and his daughter Amy Barge were both my mentors, and they've both left this plane. And they were famous chiropractors, and Dr. Barge had invented a table that actually had a reverberating plate. So instead of dialing in with a spring, a mechanical tension, and dropping the person that 1/4 inch through space, he had a table that would cock, and when the doctor would thrust, instead of the doctor thrusting once, the table would actually re-cock itself and fall several times with a pneumatic lift. And so Dr. Barge created that and created a special table, and it was really, really a cool method, and it was neat to see him adjust low backs with that method. There's a soft tissue method called NIMMO. NIMMO is a soft tissue method where people work on tendons and ligaments and trigger points instead of giving thrusts to the spine mostly. So you're correcting soft tissue to correct the spine. There's a directional non-force technique where doctors use their thumb and they contact some tissue or a bony protuberance, and they do an elbow extension, which is their thrust, and they pull on that area so it's less than a thrust. There is network chiropractic, which is a emotional and energy-based technique that has to do with emotions and energy and a spinal rhythm that is very esoteric, and a lot of people get great value out of this. Perhaps one of the most famous chiropractic techniques is the Activator method. This is one of the most researched methods in chiropractic because it's easy to study. It's a gun. It's basically a little tiny device that was borrowed from the dental profession. Dentists used to need a little, and they still do, they used to need a surgical tool that was a metal, stainless steel, spring-loaded device that had a metal tip on it, and they would place it on a tooth that they needed to crack during extraction, and they would pull the trigger, and this little piece of metal would move a 1/4 to 1/2 an inch, and it would hit the tooth and crack it, and then the dentist could remove, of course, under local anesthesia, the dentist could remove the pieces and take these difficult teeth out. Well, chiropractors looked at this a number of years ago and put a rubber tip on it and said, hey, we could make this, it's very gentle, we could take this and put it on the skin and we could adjust the spine. And so there's no risk of cracking the spine. You've got this great, nice rubber tip on it, and you're going through lots of skin. So it's not like you're right on a bone. You've got lots of skin and tissue and muscle and subcutaneous fat. So you're not really going to ever crack a bone. But the idea is that you can move bones with much, much less force than you can with your hands. So you can have much faster delivery and much smaller excursion to move a joint, and you can pull the trigger multiple times if you need to. And that's the Activator method created by Arlen Furr, just a wonderful chiropractor who created this method, and a whole method of analysis of analyzing the spine and figuring out where people need to be adjusted and how they can be adjusted by this little gun, which is so gentle. You can use it to adjust babies and elderly people with fragile spines that can't handle a regular osseous chiropractic high velocity, low amplitude HVLA adjustment. One of the methods that you may have seen the most is the Gonstead method. The Gonstead method was invented by Clarence Gonstead in Wisconsin. He's a chiropractor that's long since deceased, but he had an extremely large clinic in Wisconsin, and he influenced the chiropractic profession immensely because he created a series of adjustments. He had huge hands and big thumbs, and he created a whole lot of moves that were done in a chair and some that were done in a knee-chest table where a person was on all fours, like they were going to crawl around. And he created a number of side posture adjustments, and these were very dynamic adjustments. Now, I don't want people to be afraid of dynamic adjustments, which are to say big adjustments where a person is on their side and they're twisted and there's a big cracking sound from their low back, or they're sitting in a chair and their neck is held in a certain position and then thrusted on, and the adjustment is delivered and you hear a crack in the neck. This is similar to the diversified technique, which is a kind of a watered-down version of the Gonstead technique where patients are lying down, and you may have seen them on YouTube. It's probably the most popular YouTube kind of adjustment. Someone's lying down face up and the doctor's holding their head and they turn their head and twist it and you see a thrust and you hear a pop. These dynamic adjustments are often wonderful for a person to feel. They create a barrage of afferentation that go up to the brain and the thalamus and activate the cortex. They can activate joints. They can increase synovial fluid production. They can increase local blood flow and blood flow in the brain and brainstem. So they can be invigorating. They feel like a bracing, wonderful dip in cold water sometimes. And sometimes people feel invigorated after an adjustment. Sometimes they feel tired and want to sleep after an adjustment, and they can go to sleep. Sometimes they have reactions where they retrace old injuries after an adjustment. There's lots of things that can happen after a chiropractic adjustment, and we'll get into more of those explanations, but I want to get through some of those techniques. Chiropractic can change immune CD4 cells, it can change blood flow, it can change hormones, it can do amazing things, but it's not predictable in that we don't know in everybody what it's going to do all the time. So chiropractic is tough to study, but we're doing a good job, and there are scientists all over the world. There's a great contingent in Europe, and there's a great contingent in the United States that are doing really powerful work. There's also a group in Asia, a whole bunch of people in Asia that are doing chiropractic research and studying the mechanisms. There's also the Motion Palpation Institute method, which is a method where, in fact, my brother is a fantastic chiropractor who has studied this method and been a teacher for that group. Motion Palpation Institute advocates that you study the end range of motion of a joint. So you palpate or examine with your hands, you palpate the person's spine and you push and bend their spine to see how it moves in the end range, what's called joint play and end range or end feel, which is an examination not just of where the bones are statically when they're lying on a table or standing up or through an x-ray, but how they move. And so they might take a joint and bend it all the way to the end and see, is it healthy? Does it feel the way it's supposed to feel, or does it need an adjustment? Is it something that's fixated or subluxated or what they call joint block in some of the European literature? And then they deliver a thrust to move it. And these are some of the most skilled adjusters in the world. They have incredible skill and they can adjust really anything without any equipment. So you'll see some chiropractors use a great deal of equipment. Some chiropractors use no equipment and all they need is a bench or a chair, and they do everything with their hands. Some chiropractic used to be a philosophy that said by hand only, and others were less of a purist and they said, well, you can use machines. Some chiropractors were straight chiropractors that said you can only adjust the atlas, or you can only adjust the spinal articulations. You can't adjust the shoulders or the elbows or the extremities, the knees, the wrists, the elbows, the ankles, and the toes. I think it's important to understand that those chiropractors that did extremity work were fantastic. I've done extremity work, and I like to adjust the bones that are extraspinal. I think it works very well, and I think it's very useful. And then there were chiropractors that were called mixers, which were chiropractors that did other stuff. That means they did things like adjust the arms and legs, or they did nutrition, or they did lab testing, or they did dietary work, or they applied sunlight, or they applied color therapy or sound therapy, or they administered ultrasound or physical therapy, or they administered lasers. And so some chiropractors were very purist in the past, and they called them straights versus mixers. So that's a little bit of history of chiropractic. I hope it's helpful to you, and we'll talk more about the mechanisms of chiropractic neurologically and endocrinologically later. But thank you for listening to this long explanation.